Hi, my name is Craig Gordon. I represent the N.E.A.D Foundation. That stands for Nutrition and Exercise versus Addiction and Disease. So I go into public speaking and presentations, and I usually like to ask some questions. One of which is, does anybody know what the first 9 symptoms of hypoglycemia are? And frequently, even amongst professionals, no idea. So let me share them with you. Exhaustion, depression, irritability, anxiety, nervousness, constant worrying, headaches, insomnia, forgetfulness are the first 10 out of maybe 100. And collectively, a lot of people have quite a few more than one. And could you imagine what that feels like on a daily basis for years to own and maintain, for instance, insomnia and anxiety, or nervousness and exhaustion, or depression and forgetfulness? So a lot of these in combination make people miserable, and they don't even realize it. So what does that do? Beside their blood sugar is already a little messed up or imbalanced, they want to go on little biochemical or behavioral vacations from feeling uncomfortable or downright miserable. Maybe uncomfortable and miserable is more normal than we care to admit. So then I talk about how many have ever heard the words violence and nutrition in the same conversation. Have you? Tend to doubt it. Most have never contemplated the fact that virtually all criminals and people having a hard time behaving themselves are hypoglycemic, are malnourished, have poor eating habits, don't get proper exercise, are dehydrated, and often their body, rather their brain, follows their body like a perfect shadow. Hyper depressed, hurry up, wait, happy, sad, all day long, like I were sitting there poking you in the chest, like that. Wouldn't be too happy, would you? I think that's a lot more normal than you think. And that because of ubiquitous malnutrition, we think that's normal. Very sad, very complicated, and very preventable. So we need to take nutrition and exercise a whole lot more seriously. We need to hydrate, we need to take care of ourselves. Another subject. Does anybody know how many diabetics or pre-diabetics there are in the United States? There are literally 100 million pre-diabetics. That probably includes you. And you probably see the symptoms and telltale signs and indicators all around you, but they are considered normal, so they're ignored. So we glaze over at the typical behaviors and isms. Maybe that's not such a great idea. Maybe we need to pay more attention to all these little exacerbators and symptoms that gnaw away at the underpinnings of your behavior and of how you feel and think and process information. How you see the world. So, wouldn't it be interesting to get more serious about nutrition and blood glucose disorders as a topic of conversation on a regular basis? How many think prescription drugs are a viable solution to mental health issues? A lot of people think they've got anxiety, they go to a psychiatrist. Psychiatrist sees them, talks to them. You try to report your symptoms. There are no real tests in mainstream psychiatry for depression, for irritability, for anxiety, for this, that, and the other thing. They rely on your accurate description and depiction of the issues, and then they prescribe drugs. Maybe that's not such a great idea. Maybe we need to get serious about nutrition. There's now an association of nutritional psychiatrists. These psychiatrists deploy nutrition, exercise, nutrients, and consistent healthy habits rather than psych drugs and a reliance on talk therapy. And they get great results when people follow their program. So these are nutritional psychiatrists. Isn't that interesting? And this is a growing segment. So, my name is Craig Gordon. Please get back to me. I'm at the N.E.A.D Foundation, N.E.A.D USA.org. Learn about what we do, what we represent, and how we can all better handle these many issues that we deal with family and friends. Thank you.